Sleep apnea is a term we often hear to describe a serious condition that affects about 18 million Americans. So, what exactly is sleep apnea, and what are the different types?
There are two primary types of apnea. The first is obstructive sleep apnea, and with obstructive apnea, patients are unable to breathe because of airway collapse, and their air passageways are blocked by soft tissue or other abnormalities like large tonsils or nasal congestion. And then the other type of apnea is central apnea, and central apnea occurs because the brain doesn't trigger the body to take a breath. The typical symptoms that suggest someone might have sleep apnea are loud snoring and waking in the morning feeling poorly refreshed. If in conjunction with witnessed corroboration of gasping and choking, those would be symptoms that might suggest sleep apnea.
If ignored, sleep apnea could lead to severe physical consequences.
Untreated sleep apnea is associated with significant increased risk of vascular complications such as arrhythmias, pulmonary hypertension, heart attacks, and strokes. In the mild end of the spectrum, patients may benefit from using a dental appliance that causes advancement of their jaw to prevent soft tissue sliding back in their throat. Positional therapy, there are some people who only have apnea on their back, and if they avoid sleeping in the position where they're most at risk, that can be an adequate treatment. But in people who have mild, more than mild apnea, typically we treat those patients with a treatment called CPAP.
CPAP is an acronym for continuous positive airway pressure.
With CPAP therapy, air pressure, plain air, not oxygen, is pushed through tubing into a mask, and that air pressure helps to maintain an air splint mechanically to hold that patient's throat open and prevent it from collapsing when they sleep.
Another method used to diagnose sleep apnea is to conduct a sleep test, like this one. The test monitors your blood pressure, blood oxygen levels, and other factors while you sleep. But doctors say lifestyle changes may be all you need to avoid sleep apnea.
Weight loss and then avoiding the use of sedatives before bedtime, using alcohol or sleeping pills or other medications that might cause sedation increase the risk of relaxation of the airway and make apnea more likely.
For Novant Health, I'm Jack Brayboy.